Welcome to this section. Today I am going to continue a systematic pharmacology series. I am Biswajit here and welcome again. Let's start it. Before understanding what the drug for cardiovascular, and at first we understand what is the pathology of heart failure. Before understanding the what is the pathology of drug failure, we must be understand what is the topic we must read. At first, drug affecting angiotensinogen system. Then second one is cardiac glycoside, and which is mainly we discussion about digitalis. The next one is anti-arrhythmic drug, and then anti-anginal and other ischemic drug. The next one is anti-hypertensive drug. Before understanding the heart failure, you must understand what is the preload and what is the afterload. And before understanding preload and afterload, you must understand what is the venous return. Venous return, it means how much the blood comes by the inferior vena cava and superior vena cava. We know our heart is 4-chambered. This is right artery, and this is right ventricle, and this is left artery, and this is left ventricle. We know preload mainly it is diastolic pressure and afterload is mainly systolic pressure. Before understanding preload and afterload, mainly we understand the preload mainly defined as the end diastolic pressure when ventricle is filled, when right artery the मतलब right artery or right ventricle when filled, the end diastolic pressure of superior vena cava, then in which we are right, the preload is directly proportional to venous return. I think you must understand what I am telling. The next one is afterload. Afterload, it depends upon the aorta. When left ventricle pumping the blood, it afterload depends the lumen of aorta. And then we started next. I think you must be understood. Then we started next heart failure. Previously we discussed what is the preload, and it is more we must understand more the venous return than more the preload. Then we also discuss about afterload. Afterload mainly depends upon the arterial or aorta. The discussion about before the drug, we must know what is the function of heart, as well as we know it is collecting the deoxygenated water after purification by the help of lungs. It oxygenate, then it is circulate whole body. Before we commonly understand what is the heart failure is nothing but it is the heart unable to pump, the unable to pump. Then what is the demand of body, and then why heart failure occurs. Heart failure is mainly occurs due to systolic dysfunction and diastolic dysfunction. In systolic dysfunction, what is the our ventricle cannot enable to empty our blood, so that it is heart cannot work. In a diastolic, we can inability to feel the ventricle cannot feel. This is the heart. This is the left ventricle cannot be filled, so that it can be may occurs. Now we discussion about what is the drug for CHF, congestive heart failure. It is the mainly two type drug. This is the inotropic drug. The next one is compensatory drug. In inotropic drug mainly comes digitalis. This is the inotropic drug, and otherwise comes other drugs or compensatory drug, diuretics. Then other one comes. Next discussion, what is the drug for congestive heart failure. May simply before say cardiac glycoside with dejection digitalis, whose mechanism in Na plus and CH minus. Then systematic sympathomimetic dobutamine, and which is the beta 1 drug. Then PDE3 phosphodiesterase 3 inhibitor. Then second one, this mainly these are the inotropic drug. These are mainly used in mainly used in congestive heart failure, but other one that drug was compensatory drug. These diuretics, high selling diuretic furosemide and bimazomide. The next one, the thiazide like hydrochlorothiazide and aldosterone antagonist, beta 1 blocker, metoprolol, bisoprolol, then vasodilator, vanadilator and artery dilator. Then SCE inhibitor. SCE inhibitor मतलब angiotensin converting enzyme inhibitor. Then next one we discuss about cardiac glycoside. Cardiac glycoside drug, which is mainly discussion about digitalis. Then digoxin. Now we know about what is the mechanism of digoxin. In digoxin, this is our heart, and this is the wall of heart, and this is the wall of heart. This is mainly in which the L type of calcium channel present in heart. Mainly you got it. This is L type of calcium channel is present in heart, wall of the heart, right? Then 1% of the calcium channel enter into the interfacial surface, or interfacial, we also called that interfacial fluid, 1%. Then in here, this is the sarcoplasmic endoplasmic reticulum calcium channel present in here, so that the calcium channel activate RYR2 system. Then the 99%, 1% coming from the L type calcium channel. Then 99% calcium are out from the sarcoplasmic reticulum. Then the 99% calcium channel are, you mainly know that calcium means, you understood the calcium means contraction. In where the calcium present, it must be here. In here construction is mainly present. And then after that, after contraction, then calcium, the 99% calcium channel is entered by the sarcoplasmic endoplasmic reticulum epiphyse. Then the 1% calcium channel, try to understand what I am saying. 1% calcium channel is exchanged by sodium calcium exchanger, the antipod. And then the calcium channel will be across the cell membrane, but dejection, then the sodium channel will be, then here is present the sodium and potassium epiphyse, in which the sodium is sodium means out of the cell membrane, then the calcium input our cell membrane. but the digoxin works. Here is a digoxin the blocks the Na plus and sodium activase, in which the sodium cannot outthrow the cell membrane, so that the NCX channel cannot work. Then 1% calcium does not get up the through the cell membrane, so that 1% sodium channel 1% sodium channel which is present in the cell membrane, which is causing more contraction, so that this is the cardiac glycoside mechanism of action. Then we this is the thank you for visiting.